Hello, everyone. Welcome to the My Health Onsite program entitled Let Us Show You How to Prevent the Flu. Today, we will be talking about the flu and ways of hopefully preventing infection. My name is Chip, and I'm a registered nurse educator with My Health Onsite. I'd like to thank you all for attending this session today, and hopefully you'll learn a lot about how to prevent the flu. So today we're going to be talking about the flu in relationship to what it might be as far as periods of contagiousness. Is it a flu? Is it a cold? Some of the complications that can result if you have the flu. And what is a virus? Specifically, what is the influenza A and B virus? And how does the flu spread? And how do we actually catch this flu virus? How does it replicate in our body? How can we acquire health habits that can help stop germs? And how can this flu be prevented? So we're going to talk about talking with your provider, how to clean and disinfect surfaces, and what to do if you get the flu. We'll talk about some medications that a provider can help you get a better understanding of, perhaps take as well. So there it is, the flu. It can really hamper us. Our body is taxed when we fight the flu. It can make more sick days, take us to the doctor, affect our general life, child care, increase hospitalizations, clinic visits. So we definitely want to try to find ways of preventing the flu. So did you know influenza is known as the flu? The flu is an abbreviation for the word influenza. It's contagious, and I know we're all adults and we know that we can catch the flu, but what this really means is it's contagious from one person to another person. Symptoms do vary. A lot of people have mild symptoms when they have the flu, but not everyone. The flu can be deadly. It is caused by viruses, not a bacteria. And again, it can be life-threatening, so it's important to know if you have the flu. So over a 10-year period, the estimates for flu annually about 36,000 deaths per year, but the numbers have actually increased. 200,000 people are hospitalized annually. Last year, there were more than 200,000. 90% of deaths are people 65 years of age and older. So it's important to know whether you have a flu or a cold. Again, flu can be very dangerous, especially if we're very, very young or older. So you ask yourself, one day you're sniffling, achy, a little tired. Gee, what do I have? Is it a common cold? Do I have the flu? Actually, you could have either. So you have a mild cough, but no fever. You ask yourself, you are dealing with, it could be a common cold, it could be a flu. Again, you could have either. So it's important to know, and one of the best ways to know is, if you don't know, is make an appointment to see your provider. So what if your ears are ringing? You could have what? You could have an ear infection. You could have a common cold. You could have either. So you're no longer congested, let's say, or achy, but a cough has lingered for over a week. Could it still be a cold? Yes. Maybe you think, no. Maybe you're not sure. Another reason to see a provider. So what should you do if your cold symptoms get worse after 3 days? You might think, well, I'll just get more rest, which is probably a good idea. You can call a medical provider. Yes, especially if you have conditions like diabetes or asthma or congestive heart failure or chronic obstructive pulmonary disease that may complicate your illness. You may also take over-the-counter medicines for your symptoms, but it's important to know which over-the-counter medicines to take. And your provider is a great resource to help you understand that, to see what's going to work specifically and best for you. So your body responds differently to different viruses. The rhinovirus on the left is the common cold. On the right, the blue virus is represented as the influenza, the flu virus. So you can see they are different and the body responds differently. So you ask yourself, is it the flu or a cold? Well, with the flu, you may see a sudden onset of the flu. He may go to work one day, and by the end of the day, wow, I feel terrible. Comes on quickly. You can get a pretty substantial fever with the flu, headache, chills, body aches, but you don't always get a fever with the flu. For a cold, it's more of a gradual onset. Now, today I have a little stuffy nose and runny nose. The cold is less severe than the flu. Sometimes it can last longer than the flu, but less severe. It's a shorter duration as well, as far as the intensity. Both have some overlapping symptoms like sneezing, coughing, sore throat, and weakness. And if you look at a roadmap of how it affects your body, it affects systems in your body, like a central nervous system, your head. You can get a substantial headache. Systemically, high fever, a warm body, feeling warm all over. Muscularly, extreme tiredness, fatigue. Joints can ache. The nasopharynx can be affected, runny nose, stuffy nose, sore throat, just general aches. Respiratory wise, now the influenza virus is a respiratory illness. You can certainly get coughing and upper and even lower respiratory symptoms. Gastric, some people actually have nausea and vomiting with the flu, but remember, influenza is a respiratory virus. A lot of people who say, I have a stomach flu, it's not influenza. So, period of contagiousness. People with the flu are most contagious in the first 3 to 4 days after the illness begins. Healthy adults can also infect others 1 day before symptoms develop and up to 5 to 7 days after becoming sick. The time when a person is exposed to the flu virus and infected to when symptoms begin is about 1 to 4 days, with an average of about 2 days. So complications of the flu: bacterial pneumonia, ear infections, sinus infections. And one reason is because your body is working really hard to fight this flu, and it can become compromised, so secondary infections can result. So worsening of medical conditions. If you have diabetes, diabetes can make it more difficult to fight infections. And flu rather, can actually increase your sugar or glucose levels in your blood. It's important to measure your blood sugar more often when you have the flu, and be sure to let your provider know that you have the flu. Also the same for asthma. With the influenza being a respiratory virus, asthma is a respiratory condition, and it can be made worse with the flu. Of course, congestive heart failure as well. It affects the heart and the lungs. So what is a virus? There are many, many types of viruses, and they affect our bodies differently. A virus is a microscopic organism that can replicate only inside the cells of a host organism. That host would be me and you. Looking to the left top, you'll see the HIV virus. To the right is hepatitis B, Ebola virus. On the bottom, adenovirus, influenza, and bacteriophage. So the viruses do look different, and they respond differently in our bodies. But most viruses are so tiny, they are only observable with a microscope. What this means is what you can't see can hurt you. What's on surfaces, what's in droplets when people cough and sneeze can affect you. So viruses infect all types of organisms, including animals, plants, and even bacteria. So viruses can produce havoc on a lot of different things in our life. So we're talking about the flu. So what is the difference between influenza A and B? Well, when you go to My Health Onsite, we can do a rapid nasal test to determine whether you have influenza or not, and if you do, whether it is type A or type B. So what is the difference? Well, strains of influenza A can be carried by and spread by animals. We may have heard over some time ago the swine flu or the bird flu, avian bird flu. Strains of influenza B are exclusively contracted by humans. All ages, all genders, all races, we can all get the flu. And we can transmit the flu to other people. So how does the flu spread? Well, respiratory droplets is a big way that the flu virus can spread. Contaminated surfaces, contact with a virus. Just because someone sneezes doesn't mean you'll get infected with the influenza virus. It has to actually be in that water droplet. So infected persons, you got to know who is infected. And you can actually, if someone is infected with the flu virus, you can always ask them to please stay 6 feet away, or maybe not come to work. I mean, you're not saying no to their friendship or their work. You're saying no to that infection. So not washing hands is another way the flu can spread. So how do I catch the flu virus? Airborne. You can see the water droplets coming from this man's mouth. The virus is spread by tiny droplets made when people with the flu cough, sneeze, or even talk. Droplets land in the mouths, noses, and eyes of people nearby. The virus can enter the body through the mucosa, the pink areas of the eye, the mouth, the nose. Viruses can survive 2 to 3 hours in droplet form. So how do I catch the flu virus? The virus enters the respiratory tract. And the respiratory tract involves your nose, your nasopharynx, your trachea, where your windpipe. You can put your hand on that and feel your throat. It goes into 2 bronchial tubes, which go into your lungs. That's the respiratory tract. After entering the respiratory tract, the virus starts to replicate or duplicate itself. The respiratory tract becomes swollen and inflamed. Once inside the respiratory tract of the system, the virus enters the bloodstream. The first symptoms of flu begin to show. So this illustration shows us how the virus replicates inside your body. You can see the top left, there's an arrow pointing towards a virus that's floating in your bloodstream. Now, it attaches to a live cell, and it encapsulates and then enters your cell. And it uses your cell's brains and mechanics to make more of itself. It's called viral replication. It assembles itself, and guess what? When 1 went in, perhaps 3 come out. And now we have 3 in your bloodstream to do the same process over again. And this is how the virus replicates. And when it becomes to a certain viral load, we start to become symptomatic. Contact is another way of catching the flu virus. Think about all the things that we touch all day and things that other people touch all day that we may touch. It goes from personal items at home to work to restaurants to computers, cell phones, pens, glasses, cups, door handles, microwaves, telephones. The list is endless. Flu viruses capable of being transferred to hands and causing an infection can survive on hard surfaces for up to 24 to 48 hours. Humidity, light, and temperature affect how long viruses survive on hard surfaces. Flu viruses capable of being transferred to hands and causing an infection can survive on tissues for about, any guesses? About 15 minutes. So good health habits can stop germs. Now, we're all adults, and I know we've all heard the importance of washing hands, washing hands, washing hands. But an example might be if we buy a piece of fruit from the grocery store, let's say a lemon, and we look at the lemon and it has a dried leaf on it. We put it under water, but we don't stop there. We actually take our hands and we rub the debris and we remove it from the lemon. That's kind of how we wash our hands and remove the viruses. When we scrub our hands, it helps lift the germs and the water can wash them off. Soap also helps lift the germs so that we can remove them from our hands. Hand washing is extremely important for the prevention of the flu. So wash hands frequently with soap and water for about 20 seconds. 30 to 40 seconds of washing can reduce up to 99% of the germs on your hands that may cause infection. So basically, the more you wash those hands, the better. But you don't want to get dried hands. Use lotion to keep your hands moist so you don't have cracked skin. Avoid close contact. Stay 6 feet away from people who are sick, coughing, or sneezing. Wear a mask or a face covering. This helps you prevent infecting other people by keeping droplets from your mouth and nose from entering the atmosphere and onto objects in the room. Stay home when you are sick. Other good health habits, the alcohol gels. So hand washing is your first choice. If you can't wash your hands with soap and water, then an alcohol gel can be used. Use an alcohol-based sanitizing gel or wipe with at least 60% alcohol. You can look at the label to see the percentage of alcohol. Put enough gel in your hands to cover all the surfaces, including between the fingers, around the nails, on the back of the hands as well. So rub hands together until hands are dry. This should take about 20 seconds. The amount to use would be about the size of a dime. Some dispensers really unload a large volume and you have the tendency to want to wipe it off. Just wait, let it dry. Do not rinse or wipe off the hand sanitizer before it is dry. It takes a while before the alcohol actually kills the virus. What happens is it breaks down the outer wall of the virus and exposes the inner contents, and then that starts to kill the virus. It isn't instant. It has to be on for at least 30 seconds. And when you wipe surfaces down, some of those chemicals take up to 2 to 3 minutes before the virus is actually killed. Cover your mouth or nose. If you cough or sneeze into a tissue, throw it away and wash your hands, because your hands can get wet with droplet particles even when we blow our nose. Cough or sneeze into the crook of your arm or sleeve, not into your hands, because those hands are going to touch other surfaces in the rooms. Elbow bump instead of shaking hands. Avoid touching your eyes, nose, or mouth, which may contaminate your eyes, nose, and mouth with the virus. So can the flu be prevented? Yeah, you need to promote a strong immune system to help the flu become not a problem for you. The diet is a great way of doing that. It's important to eat a balanced meal with a lot of different nutrients and vitamins and minerals, proteins and fiber to help your body do the best job it can and your immune system. Think about repairing a car. If you repair a car with bad parts, that's going to affect the longevity and the health of that car. Or building a house with not good materials, you're going to have a house that's not as good as it could be. Our bodies work the same way. Putting the right nutrients in your body gives your body the ability to do the best it can. Exercise is very important. Exercise affects every cell in your body. Current recommendations are 30 minutes a day of a brisk walk 5 days a week. Of course, within your medical provider's recommendations and clearance. Exercise helps increase circulation and helps the immune system do a better job. Sleep. Sleep is very important. It's a restorative period where your body rejuvenates itself. One of the best things you can do is get enough rest when you're ill and enough rest to prevent illness. Rest. Now, you have to realize that even a good horse can't wear 2 saddles. It's important to rest our mind. It's important to rest our bodies so that our bodies can do the best they can and stay optimized for total health. Fluids are very important for life and certainly our immune system. It helps our immune system work better. And we actually can get a little dehydrated when we're ill, and the fluids is a great way of replenishing the body regarding the fluids that it needs. Staying warm is very important as well. Now, we may think we live in Florida where it's mostly warm. most days of the year, but there are days when it's cold in Florida, and the virus actually replicates more when your body is cold. So stay warm. That's very important. Stress. Well, there's a lot of people going to the doctors for stress-related illnesses. Stress affects our immune system, our hormonal system, our protein levels. Stress affects our bodies in so many ways. It's important to manage our stress and for total optimal immune system responses. So can the flu be prevented? The flu shot every year can help you stay healthy. It is the #1 flu prevention mode, the flu shot. The flu shot contains the flu vaccine. What that vaccine does, it tricks your body in building an army against the flu virus. So when you are exposed to the flu virus, you have some protection on board before the flu virus can replicate. Now, the flu shot will not keep everyone healthy. The flu shot might make you have only a mild case of the flu, however. Who should get the flu shot? Anyone over the age of 6 months. If you are pregnant, people age 50 and older, anyone who lives with or takes care of people age 50 and older. Your medical provider can best help you with whether you're a candidate for the flu shot. When should I get my flu shot? The time of year can vary, and here's why. We do see the flu in clinics, providers' offices, hospitals all year long. Now, we see more flu from December through March, with the peak being in January. Of course, the peak will change based on where we are geographically in the country, but that's why we call it the flu season. But there really isn't a flu season because we have the flu year-round. It takes at least 2 weeks for your flu shot to start working, 2 weeks for those antibodies, the army that's being built up from the flu vaccine to actually be strong enough to do its job. The shot can help keep you healthy no matter when you get it. Get a flu vaccine by the end of October. So why do you need a flu shot every year? Flu viruses change each year. So the vaccine used in previous flu shots have changed. So last year's flu shot is not the same as this year. The scientists try to determine which flu viruses are going to be prevalent in the next year and try to make the flu vaccination help fight those viruses. And why do you need a flu shot every year? The protection you get from a flu shot lessens with time, especially in older people or anyone who doesn't have a strong immune system. Are there side effects? Well, your arm might get sore, red, or a bit swollen, especially around the injection site, and can last for up to 2 days. You may have a headache or a low-grade fever for about a day after you get the shot. The important thing to remember is the flu shot cannot cause you to get the flu. People with minor illnesses, such as a cold, may be vaccinated. There will be a form that you fill out with questions to determine whether you're a candidate to get the flu vaccination on that day. People who are moderately or severely ill should usually wait until they recover before getting vaccinated. So talk with your provider if you have had an allergic reaction after a previous dose of influenza vaccine, and if you have any severe or life-threatening allergies, or if you've ever had a neurological disease called Guillain-Barré, also known as GBS. And again, those questions are on the form before you get your vaccination. So how to clean surfaces? Well, there's some key times to clean and disinfect your home, and that's daily. This includes the tables, the doorknobs, light switches, the countertops, the desk handles, phones, keyboards, toilets, faucets, sinks, many things in your home. So if someone in the home is sick, after they touch surfaces that someone else in the home may touch, like a bathroom surface, utensils, or light switches, it should be cleaned again. Now, cleaning is when we remove the dirt and germs mechanically. Disinfecting is when we actually kill the virus. So if you have a surface that's dirty, you want to clean it first before we disinfect. So what kills flu viruses? Flu viruses are killed by heat above 167 degrees Fahrenheit, that's 75 degrees Celsius. Household cleaning products can also kill the flu virus. The big five are chlorine, hydrogen peroxide, detergents, soap, which really wash the virus away, iodine-based antiseptics, and alcohols. Household wipes are often used, but it's important to realize that some wipes are just for daily cleaning, and they're not really killing the virus, although the name on the product is known for killing. Lysol is one that I have here, and I'm showing the second one in yellow as a disinfecting wipe. It says kills 99.9% of viruses and bacteria. Disinfecting wipes. So on the left, daily cleaning wipes. So make sure you choose the right product. Bleach. It's labeled as a disinfectant. Good for killing mold, fungi, bacteria, flu, and cold viruses. It does irritate mucous membranes like the skin and the airways, and reacts easily with other chemicals, so you never want to mix anything with bleach. Use cold water to dilute bleach to a 0.05%, especially for cleaning large surfaces. And you'd want to do that once a day, at least. So how do you make your own bleach solution to clean surfaces? Well, you might want to wear clothes and shoes you don't mind spilling on, pin up your hair if it's long, and wear rubber gloves to protect your skin. What you do is you mix 1 cup of bleach with 5 gallons of water. So you carefully pour the bleach into the container first, then add cold water. The bleach goes in first, decreasing the risk of you splashing bleach in your face. You increase the amounts of bleach and water to make a larger amount of the disinfecting solution. For instance, if you wanted double the dose, you want to just double the recipe. So place your lid on the container, shake it back and forth gently a few times, and mix it up, and you're ready to go. Now, never add other ingredients, especially ammonia, to bleach. That creates a gas that can take your breath away. And this bleach solution is only going to be good for 24 hours. The next day, it may smell like bleach, and that's great, but it's not going to be effective as it was when you first made it. So that solution is good for 24 hours only. So more on how to clean surfaces. Alcohol. It's labeled as a germicide. Ethyl rubbing alcohol, 70% is effective against the flu virus and superior over isopropyl alcohol. So read your labels and look for that 70% ethyl alcohol. Alcohol is flammable. Use it well in ventilated spaces. I wouldn't be cleaning around the gas stove with alcohol. It can cause discoloration, hardening, and cracking of rubber and certain plastics, so it can be drying. Soap and water is labeled as an antimicrobial or anti-germ. Now, we've seen a lot of the antimicrobials used for kitchen use, in sink use in bathrooms. Antibacterial soaps, however, are not effective in eliminating all germs. That's good to know. Antibacterial products are no more effective than regular soaps for colds or the flu. Overuse of antibacterial products can lead to antibacterial resistance and the rise of the so-called superbugs. What happens is we use these antibacterial soaps which aren't strong enough to kill the superbugs, so the superbugs are left behind. And when they start to grow, we have a large amount of superbugs. Products with triclosan may cause endocrine or kidney disruption. So products that have triclosan, we'd want to use some gloves to keep our especially with the wipes, to keep our hands free of the triclosan and keep it from being absorbed into our body. Triclosan is used in makeup and toothpaste and antibacterial soap sometimes. So be sure to read the food labels and protect yourself. Ammonia-based cleaners. All right. Effective in killing flu and common cold viruses. Does not kill staphylococcus or staph infection and bacterial infections. Alcohol-based hand sanitizers again. They do not kill all germs, like the norovirus, which is the stomach bug, some parasites, and Clostridium difficile, which you may have heard as C. diff, which causes diarrhea, severe diarrhea. Vinegar. Some people like to clean with vinegar. Oh, does it work? Malt and white vinegar is 5% acidic acid and kills the flu virus. Look at the label. Distilled white vinegar, 5% acidity. Make sure the label says that if you do use vinegar. It's not a registered disinfectant, however. It does not kill dangerous bacteria like Staphylococcus. Hydrogen peroxide is an antimicrobial, and it does kill the virus, flu, and cold. Has antimicrobial ingredients and can be effective as a household cleaner. Should only be used in concentrations lower than 3%. Your bottle will tell you that it's 3%. Just read your labels. Destroys bacteria, viruses, and fungi such as yeast. So baking soda. Some people do like to clean with baking soda. Not good with killing viruses, however, and it's ineffective against most bacteria, including Salmonella, E. coli, and Staphylococcus. Tea tree oil. It's an antiseptic. Treats minor cuts and wounds, not strong enough to kill viruses and more powerful bacteria. So what can I do if I get the flu? When to check with your provider. Check with your provider when you first get the flu, especially if you have a health condition like diabetes, congestive heart failure, chronic obstructive pulmonary disease, or asthma, and etc. Call your provider if your fever goes away and comes back. This could indicate a secondary infection. You start having breathing or heart problems, and if they're severe, dial 911. Treat it as an emergency. If you feel sick and don't seem to be getting any better, and you have a cough that begins to make thick mucus, could be a secondary infection. So what can I do if I get the flu? Seeing a provider can help you feel better. A provider can prescribe medications to help you prevent the flu, especially if you have high-risk secondary infections. Medications to help you feel better if you get the flu, and medications to help you prevent secondary infections. Tamiflu, oseltamivir phosphate. It's an antiviral medication, which means it kills a virus. You can remember this as antiviral by saying TAM, taking antiviral medication. TAM, taking antiviral medication. It suppresses and decreases the spread of influenza A and B flu viruses, helps make flu symptoms less severe and shortens recovery time, and must be taken within 48 hours after you start to feel sick. The goal is to have it working before the viral load gets too high in your body. So there's a caution. There is a difference between Tamiflu and Theraflu. I've heard patients mention, I'm taking an antiviral, I'm taking Theraflu over the counter. Well, Tamiflu, and there it is a prescription medicine to lessen the severity and duration of the flu. Theraflu, it's a symptom reliever. an over-the-counter medicine which may reduce fever, ease body aches, reduce stuffiness. It contains acetaminophen, which reduces pain and fever. Dextromethorphan is a cough suppressant. Phenylphrine, this is or decongestant rather, and diphenhydramine, which is an antihistamine. Now, not all Theraflus are the same. There's different versions based on the nighttime, daytime, and what you're actually treating. So read the label. If you have any questions, you can talk with your provider or even the pharmacist. Mucinex, guaifenesin, is an expectorant. An expectorant brings up mucus and phlegm. It's an over-the-counter medication which helps reduce chest congestion caused by colds, respiratory tract infections, allergies, flu, of course. It brings up phlegm. Sometimes it's combined with dextromethorphan, which is an antitussive or a cough suppressant. Acetaminophen, Tylenol. It's an analgesic and antipyretic, a pain reliever, and a fever reducer. Used to treat conditions such as a headache, muscle aches, arthritis, backache, toothaches, colds, flus. Robitussin, also guaifenesin, an expectorant, helps loosen congestion in your chest and your throat. Used to reduce chest congestion. And there's ibuprofen, known as Advil and Motrin. It is a non-steroidal, anti-inflammatory drug. You may have heard it referred to as an NSAID, an abbreviation for the non-steroidal anti-inflammatory drug name. It works by reducing fever, inflammation, and pain in the body, and is used for many conditions. Flu, of course, being one of those, headache, toothache, back pain, arthritis, menstrual cramps, minor injuries. Sudafed. Pseudoephedrine is a decongestant working mostly for the upper airways. It's an over-the-counter medicine used to treat nasal and sinus congestion, and congestion of the eustachian tubes that drain fluid from your inner ears. So you've seen some medications treat the lower respiratory tract, and some like Sudafed, the upper. So choosing the right medication is going to be very important. I've been to the aisle in the grocery store, and I've seen the 100 versions of treatments you can purchase over the counter. That's why it's important to speak with our provider to get the right treatment that's going to help you the best. Now, Tessalon pearls, benzonatate, is a cough suppressant. It's something that we take as a pill. The gel, capsule-looking ball, this medicine is used to treat coughs caused by the common cold. You cough with your flu, or pneumonia, or bronchitis, emphysema, and asthma. It works by reducing the reflex in the lungs that causes the urge to cough. Effects last from 6 to 8 hours. Azolestine, or Flonase, is a nasal decongestant. Flonase nasal spray is used to treat allergic and non-allergic symptoms such as nasal congestion, sneezing, runny nose, itchy or watery eyes. It's a corticosteroid that prevents inflammation. Ventolin, albuterol, a bronchial dilator. Mentioned in the respiratory system, there's bronchial tubes. One from the trachea goes to each lung. So you have 2 bronchial tubes. And this medicine helps expand those tubes so you have better airflow. Acts specifically to open up airways, used to prevent and treat difficult breathing, wheezing, shortness of breath, coughing, and chest tightness. Atrovent, ipratropium, the bronchial dilator, acts specifically to open up airways, is used to prevent and treat asthma, COPD, difficult breathing, exercise-induced bronchial constriction, wheezing, shortness of breath, coughing, chest tightness. So ipratropium and albuterol together is called DuoNeb, bronchial dilators. These two medicines work together to help prevent bronchial spasms, relaxing muscles in the airways, increasing airflow to the lungs, and is administered in a nebulizer where the medicine is put into a container and air is pushed through and you inhale this into your lungs. So information to take home: the flu can be dangerous for young and old people. The flu can be prevented. Older people need a flu shot every year. It's a good idea for everyone to get one. The flu shot is safe. My Health Onsite administers the flu shot for you. I want to thank you for joining me today with Let Us Show You How to Prevent the Flu. I hope that you've learned some techniques that may prevent you from acquiring the flu and maybe spreading it to others. I will be taking questions in a moment. You can chat and text me your questions, or you can turn your mic back on and ask me questions. And this screen right here is a list of other programs that we have in the wellness department here at My Health Onsite. You can actually complete your annual lab work and provider visit, then ask your provider to be referred into one of our wellness programs, and there are many to choose from. You can call your provider's office at 888-644-1448. So thank you again. My name is Chip with My Health Onsite RN Nurse Educator. So if you have any questions, I'd be really happy to talk with you. And again, you can chat by texting your questions to me. Remember to unmute yourself so that I can hear you. I want to tell you a little bit about our next program as well. On Tuesday, October the 20th at 11:30 to 12:30, we have a program by one of our registered dietitians on an anti-inflammatory diet. Be sure to join in on that program. It's going to be very good. If you'd like to know where you can access this recording, we'll be sending out these recordings to your email for those who attended today. You can also contact your wellness coordinator if they can provide the link to you as well. You may ask how to receive credit for attending this program today. We keep attendance when you register and join the presentation. If you'd like more information on the flu or any of the other programs, be sure to sign up for a wellness incentive program. We would be very happy to speak with you. We have RNs and registered dietitians and health coaches available for you. So there's a question about valacyclovir, help with the flu virus. The Tamiflu is a very specific medication, specific for the influenza A and flu viruses. Not all antiviral products will solve the problems for the flu or COVID-19. These are very specific. Be sure to speak with your medical provider about the treatments that you'd like that you're on or that you'd like to use for the flu prevention, because not all are specific. Whether valacyclovir is specific for the flu, I don't believe it is, but you will have to speak with a provider on that. Well, that's all the questions that I see. I want to thank you all again for attending. Let us show you how to prevent the flu. I hope this helps. Thank you. Goodbye.